All right, let's talk about one of India's most persistent and, frankly, dangerous public health crises, preeclampsia. Now, this is a condition that can complicate up to 1 in 10 pregnancies, and it's a battle India has been fighting for a very, very long time. But as you're about to see, the latest data is, well, it's pretty shocking. So let's dive in. Okay, take a look at this graph. It tells a really worrying story. On the far left, you've got 1982, where about 14% of pregnancies were affected by preeclampsia. Now just follow that line all the way over to 2022. That bar is even higher, hitting around 16%. So think about that. After 4 decades of medical advances, the problem hasn't just stuck around, it's actually gotten worse. And that leads us to this pretty stark conclusion. When it comes to the number of women actually developing this disease, it's almost as if we've gone back in time 40 years. Which begs the question, how on earth is that possible? To understand why, we've got to look at a really strange contradiction that's right at the heart of India's healthcare approach. So let's get into what the research is calling the preeclampsia paradox. It's this bizarre situation where a huge success in one area is actually hiding a much, much deeper failure in another. Here's the paradox in a nutshell. On one hand, as you can see with that downward arrow, India has become much, much better at stopping women from dying of eclampsia. That's the final, terrifying seizure stage of the disease. And that's a massive win for emergency medicine. But, and this is a huge but, the number of women developing the underlying condition, preeclampsia, in the first place hasn't dropped. It's gone up. So we've gotten great at the rescue, but we've completely failed at prevention. Why? Well, the answer is, it's tragically simple. Get this. Up to 84% of the women who end up with these severe, life-threatening complications, they either had little to no prenatal care or the care they got was patchy and incomplete. It's a massive gap in the system, failing to reach the women who need help the most. But there's another reason our approach isn't working, and it means we have to completely rethink what preeclampsia really is. For a long time, our whole understanding of preeclampsia has been, well, kind of incomplete. We've been so focused on one obvious symptom that we've been missing the real danger that's been hiding in plain sight. You see, we usually call preeclampsia a hypertensive disorder. We think high blood pressure. But the research is crystal clear now. It is so much more than that. It's a systemic cardiovascular disease. The problem might start in the placenta, but it wages a full-on war on the mother's entire circulatory system, and her heart is right there on the front lines. So here's how it unfolds, put simply. First, it starts with a placenta that just doesn't form correctly. This stressed-out placenta then starts pumping toxins into the mother's bloodstream. These toxins then go on to damage the delicate lining of her blood vessels, which makes them tighten up and constrict. And all of that constriction puts an immense, and I mean immense, strain on her heart, which has to work so much harder to pump blood through this resistant network. And this is where things can get incredibly dangerous. That relentless strain can literally push a woman's heart past its breaking point, leading to a condition called peripartum cardiomyopathy, or PPCM. This is a severe, often sudden type of heart failure that is directly linked to pregnancy. Preeclampsia is very often the trigger that pushes a vulnerable heart right over the edge. Okay, so if this is a disease that's building up over time, putting more and more strain on the heart, why aren't we catching it earlier? Well, it's because our main screening tool has a fundamental, critical blind spot. In India, the go-to screening tool is the Fogg-Gestosis score. It's a pretty straightforward point-based system. It looks at a woman's background risk factors, things like her age, if it's her first baby, if she has a family history of high blood pressure. If her total score is 3 or higher, she gets flagged as at risk. It's a simple way to spot who might be predisposed, but it has one major flaw. The score is only looking in the rearview mirror. It's all about her historical, static risk. But preeclampsia isn't static. It's a dynamic disease that develops in real time. A woman could be a first-time mom with 0 risk factors, have a low score, but the disease could still be silently and actively developing inside her. The gestational score can't see that. It can't see the strain that's on her heart right now. And this brings us to the breakthrough. To actually close this diagnostic gap, we need to stop looking at history and start measuring what's happening in the present. We need a new technology. And it turns out, it comes in the form of a new sound. So the multi-million-dollar question has always been,
how can a doctor actually see that dangerous strain building up on the heart in real time, before it becomes a full-blown crisis? How do we get from just predicting risk to actually detecting the disease?
And the answer is a technology called acoustic cardiography, or ACG. It's not invasive, and honestly, it's kind of brilliant. It combines a standard ECG, which reads the heart's electrical signals, with a super sensitive digital monitor that listens to the actual physical sounds of the heart, the valves opening and closing. By syncing up those two data streams, it can get a super precise measurement of how the heart is actually performing under stress. So what does ACG actually find? It measures something called the left ventricular ejection time, or LVET. Basically, it's how long the main chamber of the heart has to squeeze to pump blood out. In a healthy pregnancy, that's about 301 milliseconds. But in a preeclamptic pregnancy, that time is significantly longer, 320 milliseconds. It's a clear, quantifiable sign of that invisible strain. ACG makes it visible. So let's see where this fits in. The FOGSI score looks at the past, and it costs next to nothing. Blood pressure checks are real-time, but often high blood pressure is a late sign. There are advanced blood tests, but as you can see, they can cost over 6,150 rupees and need a special lab. ACG hits that perfect sweet spot. It gives us an early physiological sign of active disease in real time at a manageable cost. And it does all of this for an approximate cost of about 1,845 rupees per test. That's a price point that makes it a truly viable tool, not just for fancy city hospitals, but for primary care centers all across the country, which is exactly where it's needed the most. But here's the real game changer. It's simplicity. This tech is designed to be easy to use. Studies have shown that with just 2 hours of training, nurses can read the results with 92% accuracy. This isn't some complex tool that only a specialist can use. It's a tool for the front lines of healthcare. So what does this all mean for the real world? Well, this technology lets us design a totally new, much smarter, and way more effective system for protecting mothers, a whole new model for care. Imagine a 3-tiered system like this. At the community level, health workers use the simple FOGSI score to find women with historical risk. Then, those women are sent to a primary health center for a quick, non-invasive ACG scan. This scan is what finds out who is actually developing the active disease. And only those women, the ones with a positive ACG, the truly high-risk patients, get sent on to a specialist hospital. It's an incredibly efficient way to get the right care to the right person at exactly the right time.
Which brings us to one final and, I think, hopeful question. For a problem that has haunted India for decades, a problem where it felt like the clock was actually moving backwards, we now have a technology that lets us listen to the heart in a way we never could before. So can this new sound, the sound of science, of technology, and of proactive care, finally secure a healthier, safer future for India's mothers?